Well, today we're going to talk to Maria Renström, who is the Director at the Ministry of Health and Social Affairs in Sweden for drugs and social services. Maria Renström has been very active in this field, both in Sweden and abroad, for many, many years, and could be said to be a knowledgeable person on these issues. Welcome to WFAD.
Thank you very much. Yeah, I started already in 1973 as a social worker in Stockholm, so I think that I have experience from local, regional, national, EU and global level. I've been involved in this for 30 years more. Yeah.
So before you came into this position, you were in the European Union, based in Brussels or?
In Luxembourg, because I worked with the health determinants, as it's called, and alcohol, the EU alcohol strategy. I was involved in the development and the adoption of the EU alcohol strategy in 2006. And then I worked at WHO office in Geneva with the global alcohol strategy. So, but in Sweden I worked with all types of drugs, because I worked with the so-called Swedish drug czar a couple of years. Yeah.
The Swedish drug czar doesn't exist anymore.
No.
It has now been...
It's now included it's inside the ministry again. Then it was a special sort of task for a coordinator, and now the coordination is within the ministry in what's called the ANDT Secretariat. So in that sense you can say it has nearly the same responsibilities and tasks as the coordinator had before, but now it's more integrated in the sort of normal work at the ministry.
So if you could explain them briefly, the main tasks of the department that you are responsible for.
Well, I mean, it goes from legislation, and also we developed a policy for the government and parliament in the area of alcohol, drugs, tobacco, gambling even, and treatment and so on. And so what we've done so far, and I think that we in that sense is a little bit in the forefront, because we have developed a joint coordinated strategy on both alcohol, narcotics, drugs, doping and tobacco. So we have what we call an ANDT strategy. And along with the ANDT strategy, there are clear targets, goals, and also money to support actions and initiatives. So we have I think that we have managed now to sort of create coordination both at national, regional and local level, because we also finance, the state finance coordinators at all levels. And of course a lot to build up a knowledge base, sharpen up legislation. I mean, it's a really holistic, I would say, comprehensive strategy.
And would you say that this is very specific for Sweden, or could we find similar initiatives in other countries, or are there more shared among various departments? Or
yeah, I think that so far, I mean, I've been involved even at the global level, and so far I haven't heard that anybody has such a comprehensive strategy, including all these, that is actually also adopted by government and parliament. But I know that the trend in several countries now, for example, I visited France, they are a little bit in the same line to integrate more, especially on prevention, not to separate the drugs, but to have some sort of joint strategy when it comes. But also I know the polydrug use is increasing, so also in treatment you need to have competences that could sort of treat both alcohol and drug problems, for example.
The government is spending quite a lot of money on these issues in Sweden. What is the budget that you're in charge of?
I mean, if we talk about Swedish krona, and a Swedish krona, I would say 10 Swedish krona is about €1. So for every year we have around 30 million euros just on top of everything, because when I say, they think, oh, is that to cover everything? No, this is only to cover the implementation of the strategy, because it's the municipalities and county council that pays the sort of normal activities. So this is on top, where we really would like to support development and follow up. And we also have introduced the work on a really, really broad follow-up and external evaluation. And so I think so it's quite a lot of money for such a small country as Sweden.
Mm-hmm.
Yeah.
Well, I suppose quite a few countries will be jealous when they hear about the efforts that are put into this.
Yeah, and that we also have such a strong political support. I mean, it's not just the government. I mean, we have had regional conferences at county council level, for example, where all decision makers actually join and to discuss how should they implement to reach the common goals that we have now set. So, yeah, I think we have a quite good structure and a good history where we have competent people working with these issues in Sweden.
So what would you say are the main challenges? And if we look at all these areas, because we have problems with drugs in Sweden, with alcohol, as in many other countries, but even if it might be on a smaller scale, but from your position, what would you regard as the major challenges when fighting all these types of drugs and gambling?
Yeah. I would say to be sustained. It's so easy. I mean, one of the threats is actually when there's a lot of problems. I mean, it gets high on the political agenda. But then if you succeed, for example, we have had quite a good development in Sweden the last 5-6 years. It's so easy to sort of, now it's okay. Now we can sort of draw back, lean back and relax. So that's one challenge, and the other challenge is actually to have this real coordination and cooperation between the different sectors, because we want to build up really well-functioning change around the individual and in the families, instead of having, these sort of separate plans and work is isolated between the different sectors and responsibilities. So I think that is one of the main challenges, to keep the structure and to carry on and don't give up, and to build knowledge, I would say, and competence.
Nowadays, with the so-called harm reduction initiatives taking place in many countries, many people are very critical of what is going on in Sweden. Many lobbyists think that we are too restrictive, that we should be more tolerant in various areas. What is your opinion about that?
I mean, for example, I can relate to my visit actually at Milt in France, similar task as the one I have. They were surprised when I actually explained how broad Swedish drug policy and, from prevention, treatment, and that we have such a, I would say, human approach, even if we have a restrictive, and that we are doing so much more than just, people outside Sweden think that it's just sort of hard policy, but we have really, we have prevention, we have treatment, we work together with other sectors and so on. And that is not known enough, I would say. We need to be better on explaining that our policy is including so much more than just punishment, for example.
Now, if we think that the Swedish policies in these areas are very good, in what way does the government or people like you try to promote these ideas abroad?
We do a lot. For example, I am one of the co-chairs of the Global Network for WHO, for example. Several others of my colleagues are, we take part in all sort of, in all the forums where actually policy in this area is built. So I would say that if you think that Sweden is just a small country, now they start. We do a lot. We can't compare ourselves with US or other countries, but I would say we're quite active, and we are also considered as quite serious and quite successful in some fields as well. Not all, but some.
Well, at the end here, it sounds as if we are at a disco, but we are not. We are at a conference with the European Cities Against Drugs, the Swedish section, and you have been listening to Maria Renström, who is working with the Ministry of Health and Social Affairs and responsible for alcohol, narcotics, doping, gambling, tobacco and the social services. Thank you very much for talking to us.
Thank you.